Hi, everybody. How are you? Well, we are here today to talk about some more good news coming out of the federal health care reform bill that fits in with a lot of the budget discussions we're having here. And the really good news is that Minnesota is going to be rewarded by the federal government for the good work it's done on moving people and moving in the direction of health care homes or medical homes. The better news is that this is a direction to move towards healthcare homes that's actually being driven by good public policy. Instead of our decisions always being driven by the amount of money we have or the ability to draw down other money. And we have worked in this state starting in 2008, and Representative Murphy and Huntley did tremendous work on this in that session to move us in the direction, really the cutting edge direction of getting people, especially with chronic conditions, into healthcare homes where they can get better, more coordinated treatment, get better outcomes, most importantly, and also start to save us money by helping to manage those decisions and pay for healthcare in a different way. And I'm really pleased that the federal government has said that they are going to reward us by providing a 90% match instead of 50% match for folks on our public programs who have chronic conditions, who are in a certified healthcare home. And Minnesota is really, really well positioned among all the states in the country to take advantage of this money because of the work that Representatives Huntley and Murphy and myself and others in the legislature have done on this. In Minnesota, 73% of our clinics now are in the process of working towards healthcare home as part of that transformation. And right now, 40 Minnesota clinics are in the process of being certified. And because we have a certification process actually in place, we're ahead of the game compared to most states. So this is a really exciting opportunity. And not only is it an exciting opportunity to reward Minnesota for the good work it's doing and encourage more people to move towards healthcare homes, but it also provides us an opportunity to come up with a budget fix that will provide, I think, better services for the population currently, served in GAMC. As you know, there is this Medicaid match proposal, early Medicaid match that is out there. One of the big challenges with that is the fact that in the next biennium, there is some funding issues with how we can do it at the state level. We're hoping that this reform around medical homes, which will allow us to draw down 90% again instead of 50% for a 2-year period, which matches up exactly with the 2-year period where we have a deficit, plus other things that we're learning more and more about in this federal bill, will allow us to finance that Medicaid match until we get to 2014 and 15. The next biennium following, where we'll actually get back, because the federal government will then be reimbursing that match at 100%, that we'll be able to get through that kind of trough in the funding formula, fund it for the 2 years so that we can actually make some real progress in getting moving forward on the reforms that were included in the bill yesterday, but that are, I believe, drastically underfunded and won't work without additional funding. So the bottom line is we have an exciting opportunity here to build on good work that we've already done in Minnesota that's going to provide better care, better outcomes for Minnesotans, especially those suffering from chronic conditions, which is where we really need to make our focus if we're going to start to bend the cost curve. And we'll be able to move us forward in getting a better, more fully funded solution to serving our GAMC population as well. Representative Huntley?
Yeah, it's a real pleasure to know that Minnesota will be rewarded rather than being punished for being good, which usually is what happens to us by the feds. This expanded match, we don't know the dollars amount. We've just asked last night for a fiscal note, but I think the fiscal note will be huge for our benefit. Welcome, Senator Solon. We know that in the GAMC population that 70% have either a chemical dependency or mental health issues, and so would qualify for this particular program. We know that lots of people, we don't know the number, but lots of other people on medical assistance have a disabled or person with a chronic illness in their family and would also be eligible for that match. So, as I said, we don't know the numbers, but it's got to be very large. And the result would be, and Erin Murphy was chair of the task force that we had that did medical homes back in 2007, 2008. And so this result, I think, is great for the patients. They'll be rewarded for going into a medical home. They'll get better care. It's great for the providers because they will set up a system that allows more effective care, and it's obviously great for the state budget. So, Erin, do you want to? Surprise! We didn't tell her that.
You know, the idea of a healthcare home or a medical home, I think, you know, I was lucky to chair that committee because Tom Huntley asked me to, so I was really glad about that. But the idea of coordinating care for a sick and vulnerable population makes perfect sense to me as a nurse. It's part of what's been missing in the healthcare delivery system is the idea that the providers need to do just a little bit more in terms of outreach and connectivity with the patients to help them get as healthy as they can. As a nurse, I've done lots of healthcare education, teaching diabetics about their conditions, and that needs to continue. But I think we also need to help people with the chronic, you know, with chronic diabetes or chronic congestive heart failure. You have the tools provided to them by providers in their homes to be able to monitor their condition in such a way that we can intervene as providers sooner and keep them healthy. So for someone with congestive heart failure, if we know that their weight is going up, we know that probably means they're not getting enough fluid off their system and they're going to go into a crisis. If we know about that, we can intervene sooner with medications and diet adjustments, very nurse talk, and keep them healthy at home. And that's going to save money and it's going to provide a better outcome.